107 FM and 710 Keel. Robert J. Wright and Aaron McCarty. Guests on Keel heard via the Jack Spring Electric Keel Newsmaker Hotline. Joining us for a little bit is Dr. Todd Thoma, Caddo Parish Coroner. Dr. Todd, welcome back to Keel. Thanks for your time, sir.
Thank you, Robert.
Todd, you've issued a ruling in the Wavey Austin death, who died on April 19th while in the custody of Shreveport police and fire teams. What did you find in the autopsy?
We actually did not find a lot in the autopsy, which is not unusual in cases like this. It's simple when you do find something in the autopsy. It was not a remarkable autopsy for a man his age with a history of high blood pressure, other than the fact that his heart was a little bit enlarged and dilated. Kidneys were small, but that was all as a result of long-standing hypertension. It's easy when you find blood clots or a heart attack or something anatomic when you make when you do an autopsy. In this case, that was not the case. This was another case that you had to put the whole clinical picture together, and we had to do an exhaustive, extensive investigation, getting his medical records, looking at his clinical scenario, trying to figure out what happened. And they noted at the hospital that he had a fever. It was significantly high. By the time they recorded it was 101.5, but that was about an hour after death. So I suspected it was even higher than that. Then we had to go back and look at what had happened to him in the past. And there had been reports for 36 to 48 hours of him having some bizarre behavior. It was not typical at all of him. There had been complaints to both the police department and to the management at Parkville Apartments where he lived, and he was showing signs of delirium. Once again, delirium being a delusional, combative, confused state, and there was no obvious reason for that other than the fact that he had a fever. That's consistent with excited delirium, but all of the things that we normally see in excited delirium, he didn't check all of those boxes. He wasn't the right age. He didn't have a history of mental illness. He wasn't on drugs or alcohol or stimulant-type drugs, and he wasn't on any medication that's classically known to cause excited delirium. So it was a bit of a problem. We had to do a lot of investigation, including not just his medical records, but we had to talk to friends, acquaintances, his boss, the manager of the apartment complex, review everything to see if there were any triggers in his case, and there weren't. So it was pretty clear once we looked at the entire scenario that he had a medical problem once again, fever of 101.5, potentially higher than that, with confusion and disorientation. A lot of times on autopsy, if that is encephalitis or meningitis or some infection, we'll see signs of an infection. We didn't see signs of an infection. So the autopsy and everything that we saw was consistent with an excited delirium death, but he didn't check those boxes. Now, when he was being evaluated by the fire department, they actually watched his heart rate go from normal to slow to stop. He was on a monitor when it happened. So we know exactly what happened as far as the demise goes. He had a cardiovascular event, meaning that his heart had an event secondary to all of this fever and delirium that he had. He was rushed straight to the hospital, and resuscitative measures were unsuccessful. So there was no delay in this case, and the fire department did an exemplary job. So, I did not make a statement about this one being preventable. It's always sad when somebody dies from a medical problem. You never know what would happen, but there weren't any undue delays.
I think the term you used was the official term, febrile delirium. Is that correct? How does one get that? I guess is and nobody seems to know.
And how does it differ from excited delirium?
Well, that's more of a descriptive term. I really believe this was an excited delirium case, but I did not want to put the excited delirium on his death certificate because it has been reported several times, many times, of excited delirium without triggers, without risk factors for it. But from a classic standpoint, you'd like to be able to say that there were triggers associated with it. Now, we know that the thermoregulatory functions of the body happen in the brain, and and that's where your temperature is regulated. And what you see in both excited delirium and in this case, what I'm using a descriptive term saying febrile delirium, is that he had something going on in his central nervous system that didn't allow him to regulate his temperature, because we didn't see things like pneumonia, urinary tract infection, evidence of sepsis, any kind of place that would make him have fever. Excuse me. So it was more of a descriptive term. I really believe and wanted to list this as an excited delirium case, but chose not to. I chose to list it as just a febrile delirium with cardiovascular collapse.
You say there was no struggle with police and a taser was not used. How do you know that? Do you have video? How do you know there was not a struggle?
Well, I can tell you for the first way that I know is when the off-duty officer, who's the security officer there, got to the door, he immediately called the Shreveport Fire Department and then called the Shreveport Police Department. And there is an 8-minute audio tape where it's from the second that he made the 911 call. You can hear the police arrive. You can hear the paramedics in the background. You can hear him screaming incoherently and talking out of his head, and et cetera. And you can listen to that all the way till the time that it stopped. Literally in that 8-minute span when the fire department was examining him, doing their evaluation. During that period of time, I watched the interviews of all 4 police officers that were there, the 3 police officers that were there, and the off-duty police officer who was the security guard. Then I interviewed the paramedics who were there before the police got there to make sure that all of the stories were consistent, and all of their stories were very consistent. He was sitting in a chair, talking out of his head. He wasn't combative or fighting. He just wasn't cooperative. They went, got him up out of the chair, leaned him over the couch, handcuffed him behind his back, sat him up for the paramedics to evaluate him, and shortly after that, he just stopped talking.
Excuse me, Tom, why in that case was he handcuffed?
For safety purposes. He was combative, confused, disoriented. Paramedics got there, and when the door was open, he was in the chair screaming and hollering and et cetera, and they knew that their life was potentially threatened. I mean, anytime somebody's uncooperative and hollering and screaming, you don't want to put somebody in there that's going to get beat up. And if a paramedic went in there and got hit or kicked or spit or knifed or anything would have happened to him, boy, that'd be national news too. So what they did was they called the Shreveport Police Department to aid in the medical evaluation, and they came in, did not fight or argue with him. They just handcuffed his hands so that he could have a medical evaluation.
In the Tommy McLaughlin case, I think it was 46 minutes he was in the back of the police cruiser without medical attention. In this case, just to clarify, he received medical attention right away, correct?
The fire department paramedics were there before the police arrived. So yes, yeah. I mean, he was being watched by them, and they were, like I said, it was a matter of less than 10 minutes, and it was a matter of just a minute or two once the paramedics started to evaluate him before he got into extremis, and they rushed him straight to the hospital. So in this situation, the fire department did an exemplary job. They did everything they could to save his life. I just don't know that they could have done anything more.
When you say the fire department did an exemplary job, police the same?
I don't see any problems, and certainly I'm not an expert in police policies and procedures. I did do some exhaustive research and interviewed a couple of experts in restraints to make sure that there were no issues with the way that he was restrained. And everybody said that no, that was all standard. Now, I'm not saying that because, once again, I'm not an expert in police policies and procedures, and that review will be done by the police department and the DA's office.
Todd, did Mr. Austin have any other injuries? Black eye, busted lip, anything else that we need to know about in a world where transparency is key?
No problem. I'll answer that every single time. No, he has a few little abrasions on his wrist where the handcuffs were, not lacerations or cuts, just abrasions, which is fairly common, but only in his wrist where the handcuffs were. There was nothing anywhere else on his body, anywhere.
Caddo Parish Coroner Todd Thoma, thanks for your time.
Thank you, sir. A pleasure as always.
You're welcome.
Most appreciated.